Hi students, Mrs. Bravo here, and this video is to show you how to prepare a sterile field using a packed sterile drape. Okay, so first of all, you need to know what type of orders or what type of wound care you're going to be performing when you have to do a sterile field. It's because you're doing a surgical type of wound care or procedure. Okay, so you have your sterile drape. You also need to gather all of the supplies that you're going to need. Most likely it'll be normal saline. You want to check the expiration date, make sure that if it's been opened, that it hasn't been open for more than 24 hours. Otherwise you have to get a new normal saline. You want to have your gauze, and then I can use the container for normal saline if I need to. You have tape, you need a ruler, you have your sterile gloves if you need to collect the culture, and then you have the Q-tips, sterile Q-tips here as well. So once you have all of the supplies with you, you probably also need another a drape so that you can put on the patient so that anything falls off so that it doesn't wet the bed. Okay. So I am going to come into the patient's room, identify my patient, explain the procedure that I'm doing, perform hand hygiene, and then I'm ready to prepare the field. Okay, so you're gonna open up the package, and okay, so just so you know, guys, and I'm gonna grab it for that. The drapes, the sterile drapes, they're always folded here in the corner because that's the corner that you're gonna be grabbing. Okay, so when you open it, you're gonna see that. So you want to always leave some space here to make sure that you have enough in the table. And then you're going to grab the dressing by those little corners that I told you. And then you're carefully away from the table, away from your body, going to raise it up. And then you're going to use your other hand. Remember that you only have 1 inch, of the surrounding that you can actually touch and hold. So you want to use the blue area to put in the surface. It's blue or it's the shiny looking area that always goes on the surface. So then you will put it on the surface. You're gonna put it on the surface without touching the other stuff that I have. Like, let me just bring my chair a little bit. So my table. So you wanna put it right there, okay? So remember, 1 inch in all the surrounding area. It's my considered contaminated area, okay? So now I have done that. Now I can start putting the supplies that I need to be maintained sterile. So I need sterile gauze, and I am going to open it up away from me, right? Away from me. And anything that I put in my sterile field needs to be 4 to 6 inches, you guys, 6 inches up high from my sterile field. So I want to start putting them in there. Okay, so there's one. And then the inside of this, it's clean and it's sterile. So I am actually going to use it to put the normal saline. So I'm gonna leave it here in the corner carefully because I don't want to get it dirty. And then I'm going to put a culture swab. And this is like the hardest, guys, because if it lands outside or if it falls, then you need to get another one. So you want to open it up carefully. There we go. Okay, so you've done that. You want your trash can to be here as well. I have my pair of sterile gloves. And then I have my Q-tips here. Oh. Okay, and then you will be and then you also carefully soak them through the back. You carefully want to also toss those, and you might not need the Q-tips, okay? But just, in case that you need to apply medication to the wound, then you want to have them there, okay? So once I have done that, then you guys can see here carefully, I'm going to use this container for the normal saline. So I'm gonna put it right here. And another thing, guys, when you're performing wound care, you also have to assess if my patient is in contact precautions. Do I need to wear my PPE, you know, the gown and everything else for surgical? You would be applying that prior to preparing, okay? So you want to open up the normal saline, and then you want to dip it. Then once I have done that, I'm going to pour it 4 to 6 inches away from the container. So I have done that. Then I can put my normal saline and the right here on the side, or you know, you want to put it on the bedside table. You want the least amount of items in the table because you need it to work on. You need them to work, right, for your working area. So if I grab this from the bottom, it's okay. I put it right there, and now I am ready to put on my sterile gloves. So you want to open up the sterile glove packet, right? And you want to have that ready. Okay, so that's how I have prepared my sterile field utilizing that individual sterile drape. Okay, so from here on I could, without, you know, turning, remember, never turn your back to the sterile field, never. And by the time I put on my sterile gloves, it's because I am ready to work, you know, in my sterile field and with my patient. Okay, so there's a separate video in which I showed you how to put on the sterile gloves. So you wanna, if you're gonna, I'm just doing it in this case because I'm doing it at the same time that I'm having my sterile field here. So you opened up your gloves. You want to leave enough space on the table so that you can do that, okay? So I'm going to put on the first pair, the first glove. I'm going to put on the second glove. You want to keep your hands higher than your waist level, or, you know, at your higher than your waist. And then I can carefully discard that, okay? So I don't want you guys going like this and leaning and no, like this. It's done. So now my hands are above my waist, and now I am ready. You know, if I need to prepare my field here, put everything in the order that I needed for when I perform the wound care, it's all there in place, okay? So you might need, sometimes you need one of those suture kits, and you need to also put it in here because the suture kits have the forceps, okay, and the scissors, but you need the forceps more because you can easily grab on the gauzes, or you can get, with the forceps with the forceps, I mean, I would have put that in my field here, suture kit. If you put it there, you can easily grab on the gauze, and then you can wet it, right? You can wet it, and then you can, okay, you know, like once you put it like this, then you wet it, and then you can clean the wound, right? Without having to touch the patient. So that makes it a lot easier, okay? But you don't need to. You could also, you know, do it, you know, you put it in the water, and then you can do that. But the forceps are more, they make it easier. So it's, and then there. So my normal saline is kind of far away from me, right? So I can, if you grab from the inside of it, you can bring it closer to you, not the outside, guys, not the outside, just the inside of it, and it's now closer to me, okay? So we don't want to see you guys going over the sterile field or going like this to try to reach out, because my arm here is already going over, so that's contaminating my field. Anything that you need to do from now on, it has to be like this, you know, to bring it down here, and that's it. So if you get in a, you know, like sometimes you might need the second pair of gloves, but we want you guys to do it with one pair of gloves because you need to learn how to improvise without contaminating the area, okay? So this is how you prep the sterile field with the packed sterile drape.